might have not done it, because my experiences are like that only, that you do not go through it whatsoever been asked to you. So let me revise it in brief, so that before you go for this it will be helpful to you. So whenever we are going for arrhythmia, we should understand how the conduction takes place in the heart, because this conduction, when it's not proper, when there is some problem, then it results into arrhythmias. We know heartbeats are because of the impulses which are generated. There are various places where the impulses are generated. Okay, we call it as automaticity of the heart. That heart has got its own machinery mechanism to generate the impulse. Normally it is found only in neurons, but heart muscle, or the nodes rather, we have, they are such a typical tissues, they have it. Before this nodes and all, let us check it. What is the histology of cardiac muscle? If you remember, last year you have studied it, and there are particularly this H-shaped structure you might have seen last year, you might have studied, and this H-shaped structure, if you'll see this, this H-shaped structure is there one after, and there are bands are there. Okay, so what is there at the bands? Let us see one by one. So these are the bands, we call them as an intercalated disc. Between this intercalated disc are having, if again for that you have to go for the tissues, basic studies of the tissues, where you'll find that various junction between cells. Whenever you know what is tissue is a group of cell having a similar function or particular one type of function. Now here what we have is, we have got these cells are there, they are combined together, so it is a group of cell, one cell, then second cell, and these cells are connected with each other, and this is known as a junctions. So in tissue, whenever you will go for this tissue, you will learn about various junction. If you have not read it, please read it, it's very important, it will be helpful to you. Now in this junction, there are variety of junctions are there. At some places they are tight junction, at they are simple junction, at some places there are gap junction. So what are these gap junction? There are the tissues are there, in that the joining is there, and there are structure we call as a desmosomes and hemidesmosome. Again, as I told you, you refer the tissue what it is. So these are producing the structure that are called as a gap junction, and there are this intercalated disc are there, and because of that, one cell is, see, this is first cell, second cell, then this is the H-shaped structure where the another cell is there, or branching of the cell is there. So this cell, then it is branched with another cell, and these cells are connected with each other with the gap junction. Now you can imagine, if we have got boxes or rooms there one after another, we have two things which can possible. Okay, we have buckets rather, which are packed buckets like a cell. Then if these are having holes and connected with pipes in between, then if you fill water in one bucket, then automatically it will go to other bucket. So this is how these pipes are working. So here these are the gap junction, and these gap junctions are having pipes to what we call as a connexons. So these connexons are important there. So whenever it comes, whenever any impulse comes, suppose this is the first cell, whenever it comes to this cell, then it will automatically go to this cell and this cell, because it is connecting with the two cells. Okay, and this is how the impulses are transferred from one cell to another cell. So whatsoever impulse which is generated in SA node, that will be rapidly, because connexons or gap junctions, they play important role. So this is one important feature which is there, that has to be understood. And then because of the changes in the impulses, what happens, you should be aware about it. Okay, so I'll suggest you to read the physiology again nicely. Then next thing is there, that there are group of cells, as I told you, they are the basic conduction system to what we call as autorhythmic factors. They have their own mechanism. So these are the specialized cardiac muscle fibers, to that we call as autorhythmic factors. because they are self excitable, they do not need. Again, if you will see conduction of impulse wherever you see, whether in a muscles or in a nervous system, you will find that some trigger is there. We will find that either touch or chemical sensation like taste. In smell also, some chemical it will be getting dissolved, and then you will feel the sense. Hearing, then the mechanical sensation, that is sound waves will be there on the tympanic membrane, and from that that will be coming to the vestibulocochlear nerve. So these are various triggers are there, or there are something which are responsible for the rhythm, impulse conduction. However, here these are autorhythmic cells, and these autorhythmic cells, they are self excitable, okay, and they do this at their own. This is very important, and because of that they are called as a pacemaker cells. They act as a pacemaker, they set the rhythm of the electrical excitation. So when this rhythm is not proper, then it becomes arrhythmia, okay. Rhythm, again you have studied in anatomy physiology earlier, that is loved up sound, number of beats per hour, and type of ECG it is showing, that whole thing that comes under a rhythm. So this is a rhythm which they are making. They also form a conduction system. Specialized cardiac muscle fibers, they will provide a path for each cycle of cardiac excitation. I told you how it is there, because these are all, each cell is acting now like, example, there is a big building having so many rooms in that, and suppose each room is connected with some pipe, from one pipe to another, so that at least some goods you can pass. So you have two things, either from door you will take it out from one room, from the door, then open the next door and get in, or from the pipes which are there in between two, you can pass it. So since these are the specialized one, they have their pipe to what we call as a connexons, that passes easily. Now what will happen if this pipe is blocked? This is how arrhythmia is generated. Whenever these pipes are blocked, then this cell is not doing it. So whatsoever comes, it may pass to another cell. Suppose the connexons are attaching with the three cells nearby, and if one cell is blocked, then what will happen? Whatsoever is blocked, that will again go to the another cell, or it may come back, it may reverse back. And what it is doing is, because what was the content? Whenever impulse is there, then what happens during impulse? That sodium ion comes in. Because of sodium ion comes in, voltage gated sodium ions, they will open. Because of this voltage gated sodium ion that are opening, that will, we call it as a threshold potential. So when threshold potential is achieved, then calciums come in. When calcium comes in, then it will cause opening of various calcium channels which are present in the sarcoplasmic reticulum. So the calcium which is present in the sarcoplasmic reticulum will come out, and that will bind with the actin myosin, and because of that contraction will be there. This is how what you studied in physiology, how what happens in heart. Now suppose these are not there, if these connexons are blocked, or because of the next cell is damaged. Suppose we have got set of rooms, and from the first room, second room, everything is fine, but the third room is having some structural problem, okay, it has got damage, and because of that the pipe has got compressed, so you cannot pass the things. So the only thing happens is you have to bring it out from the door and pass it, but by the time whatsoever available was there from the pipe, from the nearby, it will go from that, and whatsoever remained in that room, because it is not going into the pipe, that will come back to the first room, and then it will there. So first room, which was actually supposed to do it once, okay, because first time it came, then it passed to the next room, then it passed to the next room, but the next room is blocked, so it is coming back to the second room, which was not expected. So that is the additional impulse is conducted, and this type of things, this is resulting into arrhythmias. I hope you are getting. So for that I repeat, the reading is very, very important, okay. So we have got a conduction system, that is a network of specialized cardiac muscle fibers. They provide path for each cycle of cardiac excitation, and that will progress through the heart. It is ensure that cardiac chambers, they become stimulated in particular one after another fashion, so that effective pumping is there. You know about cardiac cycle, how first atrias are this constricted, and then or we call it as systole of atria, and then systole of ventricles are there. So this is happening we call it as a rhythmic manner, okay, one after another, and this is not happening, then arrhythmias will be there. Now what happens, let us see one by one. The cardiac excitation begins at ACN node. You must be remembering it, last year you have studied it. And this ACN node is having an auto excitability. Because of that, it causes the release of that. The spontaneous depolarization is the pacemaker potential, and it reaches to the threshold, it triggers the action potential to the next, okay. And each action potential from the ACN node will propagate through the atria via the gap junction. I told you gap junction what it is. Connexons are there, cell to cell connection, pipes in between cells in the intercalated disc of the atrial muscle fibers, and then action potential at the atria will contract. But by the time atria contracts, the impulse will pass to the next thing, that is AV node, which is located in the intra-arterial septum, which is just anterior to the opening of the coronary sinus, and from that it will enters to the atrioventricular bundle. It is also called, earlier it was called as a bundle of His, that is called as a AV bundle, and from that it will go to the left and right bundle branches, and then Purkinje fibers, and the Purkinje fibers that will cause it. So this is what conduction system is there, that is ACN node is there here near right atrium. From that everywhere it is passing the impulses. These are going to left atrium, and okay, these three arrows you can see, these are going throughout the right atria, then they are reaching to the AV node, and from AV node this is there to what you call as a conductive system. What happens during that? So this is how impulse is there everywhere, this there, because of that auto-rhythmicity it will reach to threshold potential. From threshold potential it will be depolarization. From depolarization it will cause the impulse is generated, then it will come back, okay, and then again this is the pacemaker potential. Like that, one after another the impulses are conducted, okay. The action potential and the contraction of the contractile fibers will take place. Now again, this is very, very important figure that you have to remember for arrhythmias, okay. I told you earlier, you read about this, but as I told you, by this time I have got very big confidence on you people that you are not reading, okay, and you are just trying to attend 100 plus classes, but the basic reading which is asked to you, very few or rather no one is reading. This is very important graph to understand the arrhythmia and the drugs which are acting on the arrhythmias. So these are various phases which are taking place, okay, and these are related to action potential in ventricular contractile fibers, what happens because of that. So this is the resting membrane potential, and when the impulse comes, slowly it will come to there, then there will be threshold potential. When it reaches to the threshold potential, then it will cause opening of the calcium ion and more sodium ions. So this is the phase that is called as a rapid depolarization due to sodium inflow, because of the voltage gated fast channels they are opening. So this is phase 1 that is happening. It goes up, it goes almost to positive charge. Earlier it is negative charge, it goes to positive charge because so many channels are open, and then all of a sudden these channels will not be there. But because of this opening, because of this is the depolarization. Once it reaches to 0, we call it as a depolarization. So because of the depolarization, the calcium stores will be opening, and because of that calcium ion will be released in the cytoplasm, and this, or we call it as sarcoplasm, is muscle, and that will cause the second phase, that is called as a plateau phase. That will be causing the maintenance of depolarization. This is unique in cardiac muscle. It does not occur in other impulses. In other impulses will be similar one as we have seen earlier. The first figure we have seen. Normally this type of impulses are there. Okay. But in ventricles this will happening, because if you know that the systole is for 0.3 minutes, 0.3 seconds, so that much time the heart will remain contracted. There will be contraction of heart for that much period. So this is how this will be there, that it is because of the calcium inflow and the voltage gated slow calcium channels, they will be opening, and there will be start of the potassium outflow, and because of the sum of the potassium channels will be open. Then after that, at the end of this plateau phase, slowly there will be repolarization. That will be due to closure of calcium channels and the potassium outflow, and the additional voltage gated potassium channel will be open, so potassium will go out. Okay. Now here sodium came in. What happened here? Sodium came in, again calcium came in, then the gates were closed that were there in that. Then what is happening? Potassium is going out. Slowly when it goes down, then there is a pump that is called as a sodium potassium ATPase pump. This sodium potassium ATPase pump, we have seen it in digitalis, if you remember. Okay. That was blocked by the digitalis. So that will cause what? Throwing out the sodium which was came in, that sodium will be thrown out, and the potassium which was thrown out will be coming in, so that the balance or the homeostasis has to be maintained. Otherwise what will happen? Every time if this is happening, then the sodium will accumulated in the inside, which is normally less than extracellular fluid. Calcium will be accumulated, then how the next impulse will generate? So it has to be thrown out. Okay. So this is how the action takes place. The figure is very clear. Till the green color is there, we call it as a depolarization. Later, once it starts below 0, then it is a phase of repolarization. Okay, until it is complete, it reaches back to the threshold potential or below threshold potential. Till that, no new impulse will be conducted to that what we call as a, just a minute. Hello. Good morning, sir. बरं, मग मी तसं करू. आपण एक काम करू ना, 1 वाजत आला, 2:30 नंतर मुलांना मेसेज पाठवा. मी जेवायला नाही आज उपवास आहे. आजपासून आमचे नवरात्री सुरू झाले वेगळे. चालतं. ओके. So it causes the refractory period. Hello. So this is how these impulses are working, and this is very important. Now what I am very sure, if you have studied or you remember what is refractory period, there are two types of refractory period. One is relative refractory and another one is absolute. Okay, so you please go through it. What are the refractory period, what will happen? Okay, here refractory period, I am using Tortora which you have used just because to help you, to tell you that how you should read, what you should read. If you do not read it, then many of the terms in the arrhythmia will not be you will not able to understand. Similarly, I will suggest you to go through the what's your topic Navlasir is going to plan, then you should go for the physiology of this. Okay, maybe autocoids you have not studied earlier, but you go for the immunology, okay, various immune system actions. Then it will help you to understand some of the things about autocoids. And same is the thing about the endocrine system. Okay, anyway I will be taking it, but I want that, let me check what you have learned from that. Okay, this two system I will do it faster then. So this is how the activities are there. We know what is depolarization, we know what is repolarization. Depolarization means when the action potential which was negative, when it reaches to zero, and hyperpolarization means when it becomes positive, and repolarization means from zero when it goes back to the negative charge, then we call it as a negative. Now what are the ions which are responsible? Already we have studied. Please go through it, because whatsoever drugs which are we are using, we are going to use this drug in on these channels only, okay, so that we can change the activity of the channel, and accordingly we can change the refractory period. Okay, so everything you have studied earlier, only thing is you are either not repeating it, you are not revising it, and therefore many are just sitting blank in the class. So until and unless you are, because it was taught you earlier, why? Because it should be easy for you to understand pharmacology. So in pharmacology it is not expected, it is not supposed to teach you again. Okay, but unfortunately if you are not doing it, not always I will do it, because again there is a gap of 2-3 days before we go for the drugs. You should be aware about these things. So I thought that you should read it, okay, and go through the things which we have done earlier. Now this I will not take you, because everything was there. Correlation of ECG, you know about it, what will happen to the ECG, okay, but this ECG terms you should be aware about. What do you mean by PQ interval? What do you mean by the QRS complex? What do you mean by ST segment? Okay, what do you mean by the T wave, and what is the QT interval? So these are all, most of the things are basically used in explaining the things about the what we call it as a arrhythmias. What will happen because of arrhythmia? What is actually arrhythmia is, we shall go about. So when the rhythm is lost, what is the rhythm? We know rhythm is 72 beats per minute, and when it is 72 beats per minute, we divide 1 minute by 72, then we find that this is 0.8 second there, and this is what rhythm is there. We know about this much time P, this much Q, this much R, S, T, and this is all clear. So this is the normal ECG. Now this ECG is there, okay, if this beats are more than or less than the normal, then you will find the changes in that, because this was for 1 minute and 72 bits per minute. But if it is not 72 bits per minute, when it is much more than that or less than that, then it will show as a arrhythmia. Okay, so we have got two types of arrhythmias, bradyarrhythmias and tachyarrhythmias. Brady means which are having slow heart rate, and tachy means which are having fast heart rate. Usually bradyarrhythmias are rare. So whenever antiarrhythmic drug you study, you only study about the tachyarrhythmias. Okay, but technically or what we can say, truly speaking, anything which is not as per the correct rhythm, we'll call it as a arrhythmia. Okay, now important thing is this again you have studied correlation of ECG wave with the just a minute, I click something next. So this chapter I repeat, you please go through this. This also chart I told you before hypertension, because all the drugs which are acting, they are acting on this. Just a minute, somewhere I make the so that what we have seen is this. What are the correlation of ECG waves? Okay. So what do you mean by P? What do you mean by Q, R, S, T? This you have studied. Most probably many time questions are asked on that. They are very popular for that. Okay. And for every this very diagrammatic or figure wise very good representation is there. You go through it. This will help you to understand various arrhythmias. What are the various arrhythmias? How these arrhythmias are there? Okay, you know about cardiac cycle, that are systoles and diastoles are there. You know what is systole, you know what is diastole, and how the ECG and systole, how we can relate it, how it gives the what are the ECG and correlation between cardiac cycle and ECG. Already these figures are there, it will help you. These are very nice figures are given in Tortora, that should help you. Already you have studied it, so this will help you to understand. Now what is arrhythmia again? You know about autonomic regulation of heart rate. I told you reflex mechanism, I told you about baroreceptor, I told you earlier about chemoreceptors. Although it is physiology, but we have studied that if we block it with beta 1 blocker, and because of that baroreceptor may cause the what we can call it as a reflex changes in that. So reflex changes are there very nicely given in the autonomic regulation of heart rate and force of contraction. This you should be aware about, and this is the basis why some of the drugs which are otherwise inhibitors, example we have seen with the calcium channel blockers, the calcium channel blockers which are particularly acting on that is dihydropyridines, which are acting on only blood vessels, we have seen during hypertension. They are causes as such, they don't have any direct role, but they causes increase in the heart rate. This is called as a reflex increase in the heart rate. Why this happens? Because through the baroreceptor and the chemoreceptor, particularly baroreceptors. Okay, and this causes the activation through cardiovascular center. Then they will cause the stimulation of the nerve that is called as a sympathetic nerve or cardiac accelerated nerve, and this cardiac accelerated nerve will then increase the firing from SA node, AV node, and thus impulse rate will be increased. Okay, so this is very important about it. This will show this I hope you should go through it. It will help you a lot. How the heart rate is regulated, because when arrhythmia is there, somehow this is not working properly. Okay, so this is how the regulatory part of this should be known to us, and what are the various inputs are there, we should be knowing about it. Okay, now the next thing in that is this whole figure should help you to understand about the cardiac reserve, preload, afterload, and this is what I told you many times, because this we have studied during cardiac failure. We have seen that how we can decrease the afterload, how we can decrease the preload, and what we can do for that. We have seen Frank-Starling law. Okay, we have seen this is their health exercise and the heart, then help for the heart failure, what we can do into it. Okay, then then we'll go for the arrhythmias directly. What are various arrhythmias? There are basically, I told you what are arrhythmias. Arrhythmias means these are the problems with the heart, that is where the heart does not have the normal rhythm. What is normal rhythm? 72 beats per minute. And because of that, what is there? When there are 72 beats per minute, then we get the cardiac cycle of around 0.8 second. What we know from that, because of that, it is very nicely this arrhythmias, because of these arrhythmias, the ECGs are very what we can say symmetrical, nicely one after another, and the intervals are there, or from first P to the next P, that is P to P interval, or normally what is calculated is they are called as a RR interval, because QRS complex, R is the big peak, R is the topmost this one. So the distance between two are, okay, it should be 0.8 because that much is the heart rate. Okay, so this 0.8 is there, that means the heart rate is a normal. But if it is not there, then we call it as a arrhythmias. Okay, so I told you when it is not there, we call it as a arrhythmia or dysrhythmias. We refer to abnormal rhythm. It may be because of any reason, there can be many reasons, but basically the conduction system is not working properly. The heart will beat irregularly, it can be too quickly or can be too slowly. The symptoms will include chest pain, shortness of breath, lightheadedness, dizziness and fainting. Arrhythmias may be caused by factors that will stimulate the heart like stress, caffeine, alcohol, nicotine, cocaine, certain drugs or some damage to heart. Arrhythmias also be because of the congenital defects. I'll suggest you, if you have seen the pathophysiology, you can go through the pathophysiology by Hirschman, very nicely given. There are so many reasons of arrhythmias are there, very nice classification you will be able to find from that. Actually we don't have pathophysiology into it, it is there in therapeutics, we need not to study it, but it will help you to understand arrhythmia, why it is there and how we are treating it. So it can be because of the coronary artery diseases, myocardial infarction, hypertension, defective heart wall, rheumatic heart diseases, hypothyroidism, potassium deficiency. We have seen that there are some agents, most importantly we have seen what? Digitalis last time in heart failure, it causes hypokalemia. Hypokalemia means potassium deficiency, the decrease in the potassium level in the blood. The arrhythmias are categorized by their speed, as I told you, rhythm and the origination of the problem. There are two types, already I explained you, bradyarrhythmias and tachyarrhythmia. When the heart rate is less than the 72, it becomes brady, but it is manageable. When it goes less than 50, then these are actual arrhythmias. Tachyarrhythmias are the rapid heart rate, and when the heartbeats are more than 100 per minute. Okay, there are one more important term that is called as a fibrillation, that is rapid uncoordinated heartbeats. Okay, that is it is not coordinated. So fibrillation is rapid uncoordinated heartbeats. Arrhythmias that begin in the atria are called as a supraventricular. Supra means above, below, or they are also called as a atrial arrhythmias. And those which are originate in the ventricles, they are called as a ventricular arrhythmias. So we have got two basics classifications, supraventricular and ventricular arrhythmias. Okay, so examples, supraventricular arrhythmias or supraventricular tachycardias, where the rapid but regular heart rate is there, which is having this 160 to 200 beats per minute, that will originate in the atria, and the episodes will begin and end suddenly and may last from few minutes to many hours. Okay, so SVTs, that is supraventricular tachycardias, can be stopped by stimulation of vagus nerve. That is, we can electrically stimulate the vagus nerve. What is vagus nerve? Vagus is the parasympathetic nerve. We have seen parasympathetic nervous system. We have seen that parasympathetic nervous system causes decrease in the heart rate, decrease in the conduction. So if we stimulate vagus nerve, then it will release acetylcholine. The effect of acetylcholine through muscarinic receptor on the heart are they are inhibitory type of, that means they decreases the heart rate, they decreases the force of contraction. So thus this is one of the way by which it can be done. Then it can also have some straining like effect, difficult bowel movement, rubbing the area over the carotid artery in the neck to stimulate the carotid sinus can be done. Okay, and the other activities can be done for that, and the treatment definitely we are going to see. Then another way or another reason is called as a heart block. That is the arrhythmia that occurs when the electrical pathways are blocked. I told you about, I gave you the example of rooms and gap junction and connections. So when the next room is blocked. The first room is okay, from that pipe the sodium is going, calcium is going, again the next room it is going, but the next room is blocked. So it will try to go elsewhere. The path was fixed, it was supposed to go there, but since it is not there, it will not go there in the next cell, and it will come back in the previous cells, and previous cell will experience the twice inflow of the sodium. So twice they will experience the impulse. So this is they are called as a heart block, or they are also called as a bundle block, because they will cause the atrioventricular bundle. Most common site of the blockade is anteroventricular node. It is the first degree AV block. The PQ interval is prolonged because of that. Okay, and this PQ interval, once it is prolonged, then it will show that the QRS is affected, because the conduction through the AV node is lower than the normal. The second degree AV block, some affection potential from SA node are not conducted through the AV node, and these are called as a drop bits. Means all from the SA node, you know that firing is more, and some of the firing reaches to atrias and it doesn't convert into, and then when it comes to AV node, and then AV node is actually making it into 72 bits. Actually atrial firing is comparatively more, atria is having more impulses. Okay, so some of these are not going, and because of that they are dropped, they are not working, and because of that this drop bit will show the excitation. This doesn't reach. There are few QRS complexes are there than P waves in the ECG. The third degree is known as a complete AV block.